Good morning. I'm Dr. Kalpana, lecturer from the Department of Pediatric and Preventive Dentistry, SRM Dental College, Ramapuram. The topic for today's discussion is on first dental visit. These are the contents of the topic. Moving on to our introduction, the first dental visit is a very important milestone of the child's life. The timely visit is an essential part of the child's general health care. The age of the first dental visit helps to determine whether what kind of quality of preventive dental care can be provided onto the child and also the future oral health of the child. Next is the time of a visit. Early, it was basically around 3 years of age because the child can understand the whatever the dentist is trying to tell and around the situation. Later, it got shifted to around 12 months of age, and recently it is around 6 months or as soon as the eruption of first tooth, which is strongly supported by the American Academy of Pediatric Dentistry and also American Dental Association. And the American Academy of Pediatrics also recommend the oral health risk assessment by 6 months of age and establish a dental home for infant around 1 year of age. And in certain places like Argentine, research suggests that the child's first dental visit which basically happens around the mother fourth month of pregnancy. Why? Basically because there are many reports suggesting that the maternal oral health also determines the child's oral health. Next, what is a factor influencing first dental visit? First is levels of parental education, whether the parent is educated or not. Next is the parental attitude towards dental treatment. Next is the prevalent culture. Some culture they'll say anyway the tooth is going to fall, what is the need to go and get it checked. A fourth one is the socioeconomic status. Next is the level of motivation to take the child to a dentist and the presence or absence of pain. And Meera et al. In the study found that the average age range of the child having the first dental visit is around 6 to 12 years of age. And the most common chief complaint with it's like dental caries or dental pain. What are the goals of first dental visit? The first goal is to see the child before 1 year of age, and which will basically help the dentist to encourage or to evaluate certain things like screening or the risk assessment. Next is to see whether the child is developing, growing into the height, weight properly to determine the general health of the child. Next is to develop the dental home for the child and to see if the child is having a proper developmental milestone. And to certain age, certain habits, if the child is having any kind of dietary habits, it can be corrected. If the child is having any kind of orthodontic need for a treatment, if any kind of malocclusion, antiseptic orthodontics can be provided onto the child. And to improve the diet of the child by giving diet counseling and to instill a positive dental attitude for the child as to instill the oral hygiene at a very early age. Next is to alleviate the fear of dentist and teach the child what's going to happen in the dental chair or dental clinic around the very early age, instills a positive behavior and to develop a society which is caries free for the children and also to motivate the parents towards the preventive oriented interventions. Next, we move on to the setting of the first dental visit. Before you adding the child onto the dental clinic, there is something called as pre-appointment communication and pre-appointment modeling. Communication is basically you can do by a phone call or a mail. Phone call is a two-side communication where you can also answer certain doubts of if the parent is having anything. Mailing is a single-sided communication. You can just send the appointment date and time for to the patient. Next is pre-appointment modeling. It's basically of two types. One is the audio-visual modeling and the live modeling. Audio-visual modeling is actually a recorded version. You can take how the first dental visit is going to be for the child, what all will happen onto the first dental visit. Second one is live modeling, where you can have the child just visit the dentist while treating another patient. But here you have to make sure the other patient whom you are treating has to be cooperative, and the child who is just monitoring will see what are the other things that are happening to the kid, and the kid is not reacting much. Next is do's and don'ts for the parents before getting the child to a dental checkup. Please don't wait till your child needs a dental care. Because if the child has been very anxious, he or she will not cooperate on the dental clinic. Next is, please don't instill your dental anxiety onto the child, and be very cautious certain words what you're using before bringing the child to dental clinic, like drilling, injection. They're gonna harm you. If you're not behaving, I'll take you to a dentist. They'll put your injection. Certain words will frighten the kid. And if you can, please play dentist with your child. You can count the teeth onto the child, and you can ask the child to play dentist and count your teeth and say this is what is going to happen tomorrow onto the dental clinic. And there are certain books, one of which is written by Fred Rogers, Going to the Dentist. You can read this book to the child before taking a child to a dentist. And please inform the dentist if the child is having any kind of medical or systemic problems before starting off any treatment. Next, we move on to the steps of first dental visit. As soon as the child arrives onto the dental clinic, the first face the child is going to meet or see is the receptionist. So, the receptionist should be pleasant, smiling, because this will give the first impression of your clinic to the child. The next is the waiting in the reception area. Don't make the child to wait for a longer time. This will increase the anxiety of the child. Next is make the if the child is in the waiting area, make sure the child is engaged with toys or books, or any other methods to encourage the child into the dental clinic. Next is seeing the dentist. There are two ways. One, the receptionist can take the child to the dentist, or the dentist can come into the reception area or the waiting area and meet the child. Next is during the first dental visit, please make sure the child is comfortable. If the child needs the parent can be inside. And there are various examination positions can be used, depends on the various age group before you're doing an examination. And it can be a preliminary or the complete examination can be done on the first dental visit. If you need certain x-ray images can also be taken. We move on to the parents in or out of the operatory. And what is the positive and negative outcome of that? Positive outcome is parent dentist communication will be more. Parent can first only witness how the child is behaving in the dental chair. Time saved answering session can happen it off over here. And children aged 3 years or less than 3 years can have the parent inside the operatory. It can help them psychologically. And what are the basic cons is sometimes it can be very annoying. The parent might repeat whatever the dentist is telling or talking to the child. The parent can also be a barrier for breaking the communication between the dentist and the child. So if the parent is present in time inside the child and the dentist, both of them will divide the attention between one another. Next is the dentist may not be able to use some kind of stern voice if the child is becoming hard, behaving something differently. And parental anxiety, as I said before, will have a negative effect on the child's behavior. Next is the age appropriate guidelines. First is 0 to 3 years. There is different position like knee to knee position. You can ask the child sit on the parent's lap and the head can be onto the dentist, and you can use an infant examination table. So what are the suggestions over here? You can do a brief examination. Do not separate the parent from the child. Avoid errata. You can use micromotor but first demonstrate onto the nails. Next is 4 to 6 years dental chair. The patient can sit directly or occasionally you can ask the child sit on the parent's lap on the dental chair. What is the suggestions over here? You can start showing certain materials or instruments, whatever you're using by tell show do method, like chair movement, light, hair rotor, micromotor, drape, three-way syringe, etc. Next is 7 to 12 years. The child can directly sit on the dental chair. What are the effective TSC can be introduced onto the child for chair movements, light, suction, three-way syringe, drape and aerator. And also you can around this age you can identify or eliminate or desensitize the child if the child is scared of any certain dental treatment or dental procedure or basically the dentist also. Next, above 12 years of age, the examination can happen on the dental chair, and here the child will be very closely attached to friends around this age group. So you can motivate the child relating to the friends peer influence, like if you brush your teeth, you will not have caries, you will have a very good smile, alignment will be very good, or if you brush properly, you will not have a bad breath. Next is the Fit Talk. It is an educational program initiated from CECC in the year 2021. It is the short form for the first dental visit. It is basically an awareness program which will help and increase the awareness about first dental visit among various other specialty of dentistry. And which basically helps in early diagnosis of early childhood caries and also to give an age-wise oral hygiene instructions for the children. Moving on to the conclusion, here the overall development of the child is important than just the oral development of the child. So, next is not just the dental treatment, instill the good behavior or the positive behavior is also important, and removing the negative behavior as a dentist is very important. And you can instill the positive oral hygiene onto the child and in the very early age. Prevention is always better than cure. Around this age, you can instill a diet counseling, familial counseling, bottle feeding or nursing bottle caries can be prevented, ECC can be prevented. Certain thing can reduce the cost, time, and also pain onto the child. Next is parental education towards the preventive measures which can be beneficial for the child and also to the parents. Thank you.